This is On the Record. I'm your host, Jerome Sawyer. Whether we realize it or not, it's only been 2 weeks since the emergency orders took effect, and for many, it feels like so much longer. And here are some facts. Confirmed cases have now hit double digits. A Bimini woman became the first COVID fatality this week, and more than 200 are now in quarantine. We appear to be at the start of the surge. Tonight, my guests represent the dedicated group of individuals on the front lines. These men and women are fighting to ensure that we get the best care and stay as safe as possible. Our ongoing coverage of coronavirus state of emergency gets started on the other side of this break. So the project really pays itself back.
Correct.
They set up
Not the conference, more the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
This is On the Record, and I'm your host, Jerome Sawyer. Despite our best efforts, we continue to see the number of confirmed cases rise. My guest tonight is an expert in the area of medicine and is on the front lines doing all that she can to fight against the virus. Dr.Darbrielle Hunt-Burrows is the Chief of Service of Internal Medicine at the Princess Margaret Hospital. Welcome to On the Record.
Thank you.
I just have to have this disclaimer up top. I have a special love and affection for this lady. She treated my late mother many years ago when she was in dialysis as a dialysis patient. Wonderful doctor. Thank you very much. So this is a proud moment for me all these years later to have you back with us. But we're going to dive into why we are here, talking about what it's like for yourself and others in dealing with what appears to now be the surge, or the beginning of the surge. Prime Minister Minnis recently said our best weapon in the battle remains physical distancing and Bahamians and residents staying at home. With most of the confirmed cases having no recent travel history, I want to talk to you about what we are seeing now in terms of the increase in cases. We're double digits. This week we learned of a confirmed death, 200 plus people in quarantine. What are we seeing now?
Okay. Well, first of all, I want to thank you for inviting me here. It's absolutely a pleasure. And we have this is a mutual feeling.
Yes.
So you're very kind, and thank you for inviting me tonight. We are seeing increased numbers of patients presenting ever since the announcement of this serious respiratory illness. And ever since the diagnosis of our first case. In fact, prior to the diagnosis of our first case, we had been seeing increased numbers of patients presenting to our institution, and there has been an ongoing increase in numbers of patients. As it is now, we continue to have patients presenting with respiratory illnesses, and in keeping with the guidelines, we have to investigate those patients. We have to follow what we would call the protocols to screen those persons. We have to consider what would be the usual respiratory causes, and for some of those patients, they might have other causes of respiratory illnesses, viruses, bacteria. But for some of those patients, they might be COVID cases, and as you know, we have increased our numbers.
I want to talk about how you now divide those patients, because it's still that time of the year where we are presenting with all kinds of things relative to flu, respiratory issues, etc., as you would have stated, but yet there is this heightened concern. If I am, as an individual, if I am presenting with some symptoms, and I reach out to the COVID hotline and the hospital is notified, and I present to the hospital, what now happens? Whether I am positive or not, or what happens once I come into that system?
Okay, thank you for that question. So when you reach out to the hotline, the purpose of the hotline would be to help to determine whether or not it is likely that somebody is whether there's a concern that this person might have been exposed to the coronavirus. If somebody is presenting to the hospital, they're going through a similar process. Now, if we have a concern that somebody is at a risk for having the coronavirus, what we are going to do, well, actually at this point, the level of concern is so heightened now that most persons who are coming in with respiratory concerns will be screened, because our level has been broadened.
Mm-hmm.
And so initially, those persons will be put through what we call a respiratory panel, where they are tested for a certain number of respiratory viruses and infections, and they are also screened for the coronavirus.
Mm-hmm.
There's an isolation area where these persons are moved to, and that is an area that is removed from where the majority of persons who are being evaluated in the emergency room would be. Those persons would be there until we have the results of those tests.
So there is a specific time. Once you present, they don't just check you out and you go home. You stay until the results are final.
Yes, and I'm saying that with a bit of a caveat, because when persons are coming to the hospital, most of those persons need some level of support.
Okay.
Persons who are stable, for whom we have this concern that they might have been exposed to the coronavirus, those persons can actually stay home. Mm-hmm. and be advised to isolate. Okay, because one of the other concerns that we have, particularly when it comes to testing, and this is a bit controversial, is that we don't have all of the resources to test everybody
Right.
who wants to be tested. And so, as it relates to the hospital, though, when somebody enters into the institution who we are concerned might have been someone who's exposed, yes, those persons would be held until we know those results.
What is the threshold for hospitalization? If I present, if it is found that I am positive, at what point do you then say, okay, you can go home, or you need to be admitted because you're at this place?
Somebody who is hospitalized is someone who needs some level of additional support. So we find that persons need some level of oxygen therapy. They might need fluid, what we call fluid resuscitation. So maybe they're a bit dehydrated and need some fluid support. Persons might have started to have some other level of system involvement, and so maybe their kidneys are having some challenge, maybe some other organ system. And so there's some level of additional support that they would need beyond which they can manage outside of the hospital, and that's why they would need to stay in hospital.
There is this great concern about, do we have enough respirators? Do we have enough respirators? When are we getting more? During last night's town meeting, Dr. Sands would have alluded to it, but there are all these questions about respirators. I want to explain, I want people to understand that having the respirators is not the issue. As he explained, it's having the amount of personnel to be able to administer the right kind of care you need with a respirator. And I want us to be able to talk about that to a certain degree.
That's a bit of a complicated discussion, and it's probably beyond the scope of this discussion too. However, the respirators is not it's not the level of support that we are intending to provide within the structure of the hospital, and I hope I'm not speaking beyond what I should. It's not a level of support that we are intending to provide within the hospital structure itself. That is why units were set up for outside the hospital.
All right, that now begins to make sense.
Okay, so that's one of the strategies. But in terms of respirators, it is ideally supposed to be provided in a negative pressure environment and also with the support of personal protective equipment that accompanies it, so that any individuals who are there when the ventilator support is being provided and when aerosolization potentially is happening, all of those persons are adequately protected when ventilators are being given, when that ventilator support is being given to the patient. And so it's not just a single discussion about ventilators.
Sure.
Ventilators are being provided within a particular context. So that's why I said it's more than just
I understand, and I get it. And I think people sort of, because that discussion has happened elsewhere in the world, we have taken that now and made it our own. And do we have enough?
Right.
Do we have enough?
Right.
But that it's not as simple as that.
Right.
Right. Go ahead.
Right, and so potentially there are a group of patients who, if they are severe enough, will require ventilators. But like I said, that is a discussion that comes along with other things that must be considered in addition to the ventilators themselves.
And the Prime Minister announced in a press conference this week that a modular unit at the hospital has been outfitted with positive and negative airflow with 20 air exchanges per hour of fresh air, and that the air is treated with ultraviolet light radiation as further protection to ensure viral and bacterial kill. What does that mean?
So yes, so those modular units, so there were modular units placed there, and as I said, those modular units have the capacity to support 4 patients. And once again, that is part of the strategy for managing COVID-positive patients, and that is hoped to help us with the plan that if we do get to the point where we are going to attempt to provide a higher level of support, hopefully those modular units will be able to facilitate that. But when you say, so all of the description about the airflow and the ultraviolet light, all of that is what helps to make it very specific as a high flow, as a very adequate area for managing that level of infection.
Which you can't just manage in a regular hospital.
In a regular hospital, because the concern, so when we start talking about what type of infection is it, so remember, when people start getting into discussions about how does someone get this infection, is it because of droplets, is it aerosolized, because I know you hear that kind of discussion out on
also airborne.
Exactly, is it airborne? And so that unit, which when they describe things about airflow, negative flow is supposed to be something that helps you to control when it's an airborne type infection, and that is what all of those descriptions are trying to help manage, an airborne level of infection.
As a healthcare worker, you are on the front lines, and your colleagues are on the front lines every day. You know, you've got people coming in that, you know, could be positive, etc. What is it like for you all in that environment day to day when you're almost in a heightened sense of alert because you don't know who's going to walk through that door next that could be positive?
It's not easy. It's challenging, and at this point with the information that we have. We pretty much have to consider that everybody is positive, everybody. And so it's difficult because as healthcare workers, our commitment is that we will manage the patient. And so that means that all physicians who are on the front line have to pretty much make a decision that they are they're going to leave families themselves and have to make decisions about how they're going to protect their families and also provide care and have to know about a certain level of protection for themselves in the workplace, and then also provide this care. We're committed, and we want to make sure that we are serving our patients. So
I know you said physicians, but in that I'm sure that nurses as well. And
nurses
other
as
health
well.
professionals.
Nurses as well. There are emergency medical persons. Everyone on the front line.
On the front line.
Everyone on the front line.
We're going to take our first break in the show. Stay with us when we come back. More on this very challenging aspect of the fight against COVID-19. Stay with us. Welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
This portion of On the Record brought to you by Executive Printers of the Bahamas Limited. We print profits for you.
Welcome back to On the Record. This segment is brought to you by Executive Printers. During a recent press conference held by the Prime Minister, he said, "One thing we all did not want to hear is that we are in a surge." However, he reaffirmed government's commitment to ensure that we are all well armed for the battle ahead. My guest tonight, Dr.Darbrielle Hunt-Burrows, Chief of Service Internal Medicine at the Princess Margaret Hospital. We're going to get to the surge in a minute, but while you all are dealing with suspected cases, people presenting with respiratory symptoms, etc., how are the regular functions of the hospital going on? Because women are still having babies, people are still having emergencies, people continue to need care in various other areas. So what's the composition of the hospital right now?
Okay. So as at the moment that emergency orders began, the hospital also had to go into emergency mode. And so all services, not just within the Department of Medicine, all services had to scale down their inpatient, their inpatient levels. And so we then began discharging out all patients who could safely go to an outpatient basis. That was one thing. All of our clinics that were outpatient-based clinics, and all of our clinics that were specialty-based clinics were also canceled. We then made all of our surgical theater operations emergency-based. And so that means that those services are still functioning, but functioning to a lesser degree. So, for example, in the Department of Medicine, our overall inpatient numbers decreased probably by a third. In terms of staffing within the clinical aspect, we also had to decrease the numbers of our staff. And so what was happening in the medical aspect is also happening in a general aspect too within the hospital. So as you would know, within the country, we've had to go to essential staff only. So within the hospital, that was essential staff. Within our clinical, within our physician staff as well, we've tried to scale down our staff. And so what we did, though, to accommodate for those changes, and we knew that patients then would have been somewhat displaced, for example, with the clinics being canceled. We tried to mobilize our staff to those areas so that any patients who would have presented looking for assistance, we would have had staff available to try to accommodate them. For example, persons who might have needed to come to the ward for in-between checks, we would help them to find how to communicate with their teams.
Okay.
If somebody might have needed to have prescriptions or other things done, who might not have necessarily known to go to a local clinic, we still would have facilitated them with prescriptions, those types of things.
Okay.
And then persons who might have presented with complaints, not necessarily needing to go to the emergency room, but needing some type of care, we still had physicians who could accommodate them. So we've had to make adjustments, and these are things that we're learning as we go along. Well,
sure, yeah.
Similarly to what's happening worldwide, we're having to make adjustments as we're going along. So services are running simultaneously to our preparations for us trying to prepare for COVID patients.
I want to talk about what a surge means and what we predict that may look like for us.
Okay. So what a surge means to us within the hospital area, it means that it would mean an increased number of patients presenting with these symptoms that we suspect are related to an exposure to the COVID virus. It means that we have to accommodate and support those patients. And it also means then that there would be an increased number of staff who would need to be available to try to manage those patients for the time that those patients have to be cared for within our hospital system.
Mm-hmm. I want to talk now about the kind of treatment and at the various levels. I think earlier on we talked about what happens to inpatient care, to those people who have to be hospitalized, who are positive. What about those who are sent home, who do not need to be treated? What is the course of treatment for those individuals?
Okay, so let's just review some of what we know about how a person who has been exposed to the COVID virus infection and who comes down with COVID-19 disease could potentially present. So for most persons, so we say that this 80%, for most persons, they might have no symptoms to mild symptoms. So for those persons, they really would only require symptomatic treatment. And when I say symptomatic treatment, whatever their complaints are, if they're having fever, if they're having body aches, if they are having fatigue, they would manage those symptoms. We tell most persons to hydrate themselves. We would recommend that most persons take fever-relieving medications, preferably acetaminophen or paracetamol. That would be the type of advice that we would give those persons. And we would advise most persons to rest. Now, for the persons who require hospitalization, which would be that smaller percentage of persons, the 14, I'll say about 14% of persons who require hospitalization but who are not severe, those persons would require probably a higher level of support, possibly fluid resuscitation, and I say that with a little bit of a caveat to say that it's controlled fluid administration. Again, they might require some fever control and other medications as necessary based on the evaluation by physicians.
And being administered in a professional way as opposed to being home and taking every
as it
so
is,
often. Right.
Sorry, as it is, there is no specific cure.
Right. So this isn't, there's not a regimen in place for everyone. It's not a cookie cutter kind of. Okay, interesting. Are there things that we can do to sort of, we know the protection side, but anything that we can do to improve our, immune systems, because it's a respiratory illness, anything that we can be doing at this point, if you're not positive, things you can be doing to try and improve your overall general health in the event that you do contract the virus, or maybe asymptomatic at this point, or not known?
I think most of it is just anecdotal and things to improve your overall health. So plenty rest, try to observe overall good personal mind and body hygiene, vitamins, multivitamins. It's non-specific.
Right. So generally, you need to try and get in good health.
Absolutely,
also,
maintain good health.
People who are predisposed to some conditions. I mean, if you're already predisposed to hypertension and diabetes, etc., I mean, you're already in that at-risk category. What should you be doing, or those individuals be doing?
And so we do know that there are a group of persons who are at an increased risk. So the persons who we notice to be at an increased risk would be those persons who are at an increased age, persons who have pre-existing heart disease, persons who have diabetes, persons who have cause for immune compromise. For those persons, it would be best that their condition is controlled. And so that would be my initial advice, that as best as possible, those persons should have some level of control of their disease. The other advice would be for those persons to maintain themselves away from risk. And so that takes us back to the recommendations that have been going out at the start of this, to have social isolation, to continue with the hand hygiene, hand washing, social distancing.
And all those things we keep hearing over and over. Doc, we've come to the end of our segment. I want to say how much light this discussion has shed onto certainly your circumstances and others around you. Thank you for the great work that you do. Continue. You and your colleagues, you do us a great service. Thank you, thank you, thank you. Keep up the great work. Thank you very much.
It was my pleasure. Thank you so much.
Stay with us. Our discussion continues with another professional in medicine coming up right after this quick break. Watching On the Record. I'm your host, Jerome Sawyer. This segment is brought to you by Global Insurance Agency. In a press update this week, Prime Minister Minnis made an amendment to the emergency powers. He announced that all private medical and dental practices shall eliminate all routine and non-emergency physical encounters with patients and shall, as best as possible, provide all routine and non-emergency services using virtual or remote means, excluding private renal dialysis activities. My guest for this segment of the show, Dr.Sabriquet Pinder-Butler, a family medicine consultant. Dr. Pinder-Butler, welcome to the show. You know, last segment, I had to declare, I'm going to declare as well, this is one of my doctors as well. I don't need you to tell people how bad of a patient I can be sometimes. But welcome, thanks so much for coming on tonight and sharing with us
Thank you for having me, Jerome.
I want to talk about these virtual or remote routine non-emergency procedures. How is that working for you, and how is all of this affecting your business? You're dealing with patients day to day in your office. What's it like for you, and how will these new procedures now work?
Okay, so we as a healthcare professionals in private practice and in public service as well had been preparing for this eventuality. We had been scaling back on our physical contact with patients because we promote and support the social distancing measures. We know that that is one of the mainstays of how we're going to actually contain the spread of the COVID virus. So from earlier on, we were actually encouraging our patients to come and get their medications as needed, to call us if they needed care, to WhatsApp us, do certain types of video calls so that we can know what is happening. We also encouraged persons in public practice to do the same. So certainly as those clinics were scaled down to emergency mode, those things were coming into play as well. We want to make sure that our patients are safe. We want to make sure that we are safe and healthy so that we can take care of the patients that may become infected with the COVID-19, and that we could take care of ourselves as well. So far, a lot of the patients have been doing just that. They've been calling. We've been encouraging all of them to make sure they have direct contact with the doctor's office or cell phone. Certainly, we manage patients with other conditions like high blood pressure, diabetes, back pain, toe pain, all of those things. They don't just stop because COVID is happening. And so certainly we don't want you to continue to be in pain or get into any further distress. So call us. We are able to call in prescriptions as necessary. And sometimes if you're able to have someone actually come and get it for you because certain medications we're not able to call in. That is something that we've also been encouraging. So we've seen that patients aren't coming like they used to, and we agree you should not be coming for an annual checkup right now or something that was happening from last year. This is not the time because you're at home to now call the office and schedule something that should have been done a year ago.
Sure.
Okay.
Is there an increased risk in an instance like this? Because, I always get presented with some stomach issue, I eat something, or that's me. If I'm not feeling well and I reach out to my doctor, we're doing the telemedicine, the remote, are there any risks built into that? Because when I come to the doctor, I get examined. You're going to touch certain things, you're going to ask me certain things, it's a physical examination.
Yes.
Are there any risks now involved with this new method, and how do you mitigate those?
Right, so very good question. There are always things that we have to look at when we make certain decisions as to why we have to now see patients either virtually or via phone. Again, our main concern is preventing patients from contracting this virus. Absolutely important. So we have to weigh that with, certain things that may not be ideal. The one good thing I will say is one of the good rules of medicine, and we've been taught this from medical school, is really and truly your diagnosis of a patient should come from your history taking. So just that talking, that encounter, finding out what has happened, when this has started, where the pain may be, how long it's been, what does it feel like. Those things really and truly should already clue your clinician into what is likely happening with the patient. The physical exam actually supports what you would have likely already diagnosed. So absolutely, in this instance, the history taking is extremely important. You have to make sure that you tell the physician everything that's happening. Don't leave out any details so that we can try to make the most appropriate diagnosis as possible. And then certainly in instances where we might be able to visualize, that's where the virtual aspect is very helpful, because you could actually point to the direction of the stomach pain. Show me where the headache is happening. Those types of things. And I could demonstrate to you how you might be able to even, for example, example, check your blood pressure, because we still want patients to check their blood pressures at home, check their sugars at home, not get into those danger areas.
Right.
So, you know, the thing about it is we know that some of those things have open platforms, so you'd want to be, you know, careful with that, but we have to balance the context of which
Which is kind of like my next question. When I come to the doctor's office, it's me and you in there, and
Yes.
I'm comfortable talking because nobody's around, and, you know, I'm able to express some things to you. But, you know, when you have that call, you know, what do you advise patients to do? Should I sort of go in the bathroom? Should I be secluded so that I feel comfortable having that conversation?
Right. So we still want to always remember the basic principles of ethics. Confidentiality is still something that we're going to try to maintain as best as possible. So if you can go in an area by yourself, the physician, of course, in most instances will probably be isolating or self-isolating as well too. So we encourage that as well too, so that you can feel safe in sharing this information with us, and be assured that we will still respect your privacy too. Absolutely, those things are important.
But it's important that if it's an emergency situation, you can still have access, correct?
Absolutely. If it's an emergency situation, we're still advising you to call us, so that we can advise you to either call the hotline, advise you if you need to go to the hospital, make that connection for you in some instances, because even though we want you to monitor, we're still now going to have to be following up depending on what it is, and you still should be engaged with us as well too.
Do you find people, and this is in your own practice, do you find that people are a little more fearful of the symptoms and are calling in? Like, you know, we made the joke before the show. I said, you know, for me, every day I feel like there's some symptom I may be experiencing, and I'm thinking to myself, oh my God, is this it?
Yes.
You know, and I don't know if it's a mental thing, or maybe I just wasn't paying attention before when I sort of coughed a couple of times. But do you know, are you finding that patients are reaching out to you more because they are more nervous about things that they would normally overlook related to this disease?
Right. So absolutely, we're all more aware of symptoms that could indicate a possible infection with COVID. And, you know, the reality is those symptoms mirror so many things, you know, from a cough to a fever to stomach pains, joint pains, a headache, diarrhea. There's so many things that it could be. So you may not have paid attention before. You might usually have had allergies before, but now, because you know it's a symptom, it could be coming back to your mind. That's understandable. There's anxiety going around. All of us are anxious. All of us are potentially might have encountered someone that had virus. So we understand that happens, and this is why we want you to reach out to us so that we can get the history, find out what it is, let you know when you should be concerned, what to do if you develop the shortness of breath, what to do if the fever does not go away and you're taking the Panadol, things along that line, because we're all concerned, as we should be. But we want to also try to not allow it to overwhelm us. There are other positive things that are happening in the world, even though right now the focus is on this pandemic because it's affected every country for the most part. So every corner is affected globally, and so we're seeing it all on TV, we're hearing it all on the radios, so now we're more heightened to it. But we also want you to try to keep your sanity. While this is happening, as much as possible, try to remain calm. If you're a spiritually minded person, please, you know, pray, call on your faith. If you're close with your family members, please, and friends, stay connected with them while you're at home. There are a lot of games that we've been seeing going around on social media and other things. Play some games, interact with your children. Those types of things are extremely important to also help you get that balance. If you like to bake, exercise, especially important as well. So we have a lot of people who are calling us about that, what to do. We're putting on weight now that we've been home. We're eating more because we're stressed.
The isolation snacks
right,
are
you know, we're
kicking
feeling
in,
depressed. We can't go out and work. What are we going to do? We want you to try to stay mentally positive. It's extremely important, and to do those things so that we can help you as well.
In the Prime Minister's press conference this week, we also learned that some 50 healthcare workers have had to be taken out of the system because of exposure. I was very surprised by that. I didn't realize that number would have been so high. how would we have gotten to that? How does that happen? And once they have been sort of, it's important to put into context that they have not tested positive but
Right.
have been exposed. So talk to us about how that could have, how this scenario could have happened.
Okay. So yes, as you noted, we have healthcare workers, including doctors, nurses, and other professionals that work in our system who would have, or who are in self-isolation or quarantine. Remember now, all of us are also engaged in regular home life. We attend churches. We are sisters, mothers, brothers, all of those things to lots of different people. So we're in the community. That's one. We know that we have community spread of the virus. So inevitably, we may also be persons that have come in contact with persons with COVID-19 just from that. Additionally, we are in the healthcare system, and we are seeing persons who are coming and they may not even have symptoms, because we know that there are persons who have no symptoms. We're treating them for, let's say, for example, a broken leg, or we're treating them for their diabetes, and they don't know, and we see them and they develop COVID, and so now we're exposed. Or they come to the clinic, and this was one of the reasons too why we understood why certain things would need to be tapered down in terms of restricting who can actually access the clinic, because there were situations where patients, because of fear of stigma, I think in one instance, would not necessarily reveal to us that they have a cough or shortness of breath or even a fever. And so by the time that person accesses the healthcare system with patients that are in a waiting room, and then they get into the room to see the physician, and then we realize that this person may potentially have COVID, and then we find out that they've tested positive, you can imagine the amount of persons that they might have already exposed just from within our particular clinic. And then all of us would have then either gone home to our families, gone to church, gone to the food store, and so you can imagine.
Frightening concept, the more we think about it. Also announced this week one exemption to medical facilities with pediatrics who continue with vaccinations. How crucial are these vaccinations in this new environment we find ourselves in? I mean, women are still having children that have to be vaccinated, these things. How important is that in particular right now?
Right, so I mean, we always promote vaccinations to try to make sure that persons are protected, their immune systems as well enough to combat certain conditions that we don't want them to be at risk to. So certainly vaccines would continue to be important for pediatric groups as well as other at-risk groups as well too. So it's very important that we allow those things to still continue, and rightfully so support the decision that was made by the government in that instance.
We are at the point of a break. We have still lots more to talk about. Stay with us. On the Record will continue right after this. The project really pays itself back.
Correct.
They set up
At the conference, the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
We are now into our final segment of On the Record. In an article earlier this week in the Nassau Guardian, it was reported that the Minister of Health, Dr. Dwayne Sands, said the Bahamas has softened its position a bit on the general public wearing of masks. I don't know if I said that correctly. Well, he suggested that people should wear a homemade mask, or if they have access to masks, that would be fine. My guest, Dr. Sabriquet Pinder-Butler, family medicine consultant. That's the big question people keep asking me. We see people now even making the homemade mask for sale online. I've seen quite a few people do that. Yes. What should we or should we not?
Right. So it has been one of the controversial topics, as you can imagine. And so we are also supporting the position that the minister would have stated. We, in an ideal world, and if we had enough masks, perhaps everybody might be able to wear a mask. That is not our reality, as you know. Masks, especially the surgical ones and the N95 special masks that are for the healthcare providers, doctors, nurses, the EMTs, all of those.
You all need them.
We need them. We need them. We really need them. And so the supplies have run out. Supplies are trying to come back in. We need them. This is why we have asked persons that if they do go out, because that would be the instance where you perhaps would want to cover your nose and your mouth, that you use a cotton or a self-made homemade mask and save those ones for those of us that would really need it in our healthcare.
Disposable
Correct. So that we would have sufficient for the patients who really need us to take care of them. That is all we're asking. So again, if we have a situation where we have enough for the world, sure. But right now we don't have that. So you can wear the mask as much as possible for the public. If you're going out in the public, homemade masks preferable, and save the other ones for
Now,
us.
with the homemade masks, do you need to wash them after every use?
So ideally, we would say as much as you could wash your mask, your clothes, anything that you've worn when you're in the public and in contact with other persons would be ideal, because you are not certain what particles might have come onto the mask area, even though you're wearing it in general to protect yourself from what you're breathing in, or from others being exposed to what you might actually be breathing out. We can't see those particles. So if you can't see them, the only way to make sure that they're not there would be to clean them.
You brought up a very important point about cleaning your clothes and different things once you come in. Does that apply to items you purchase in stores? I mean, people are still going to the food stores and to the pharmacies, and we're buying, we're looking at something and putting it back, or, what kinds of measures do we need to put in place in our personal lives as we have to move in and out?
Right. So very good question, Jerome. One, because people need food. We need to eat. We encourage people when you're going to the stores to try to get as much food for at least 2 weeks, so that you're not going to the store every day or every other day, because we were seeing that quite a lot. It is not a social outing.
Sure.
It's actually putting you at risk, your family at risk. Imagine if you go to the store and you're not sure which can of cream you'd like, and you are touching at least 3 cans of cream, and then someone else that came in before you did the same thing, and it goes on and on and on, and then you don't know who would have touched it, and if that person had the COVID viruses, we know that persons may not have any symptoms, and then you take that home into your house. So we encourage you that if you're going, be decisive about what it is that you're going to get. Get your item and carry it with you. When you go home, as much as possible as well, a lot of the conversations have been about persons actually trying to leave the items outside or in a garage area before you actually take it in the home, to at least, if the virus is on there, to allow it to go away within a few days or so, or disinfect the can items, anything you bring in, disinfect it as much as you can before you actually use it, because again, we can't see these small particles.
These are things we don't even think about.
Correct. And even with our shoes, the thought is to leave your shoes outside, spray the shoes off, soon as you get in, take off your clothes, put it in an area to be laundered, and as soon as you can, make sure that the items are washed in warm water as much as you can. Those sorts of things, because again, if you're touching things that people might have touched, even though you might make direct contact yourself, if you pass a corner for say or a door and your jacket, you're not sure what got on the jacket, but you're taking it back home.
That's a very good point. I'm glad we were able to discuss that. We've got a few online questions from some of our followers. One online follower, one of our followers asked, can pregnant women with COVID-19 pass the virus onto their fetus?
Okay, so that question has come up quite a bit. From what we have read so far in studies, there has not been a direct thought to say that it can absolutely happen. I think it's still being researched. Certainly we had one of our consultant obstetrician gynecologists speak to this as well, just to make sure that, because there's still unknown things, that pregnant women should take the same precautions as all of us in terms of minimizing their risk, trying to stay as healthy as they can with their pregnancies, taking any prenatal vitamins and those sorts of things. And then of course, there's always maintenance of anything. If a pregnant woman should develop any symptoms, the same would apply to call the COVID hotline, and then those specialists would deal with it accordingly.
That becomes a little bit tenuous with the pregnant woman because there's certain medications that she cannot take, eh?
Well, absolutely. I mean, again, if it is that a pregnant woman may have similar symptoms to the general public, and we know again that 80% of persons would or could potentially have a fever or a cough, again, the Panadol or the acetaminophen are things that are generally safe to use in a pregnancy. These would be the same recommendations across the board. And certainly the medications that we would even advocate would be those over-the-counter medications so that they don't cause any harm in that regard.
Another question from one of our followers, what length of time is appropriate for the lockdown to be in place in order to give health officials the best estimate that we have succeeded in flattening the curve or the surge or spread has been curtailed?
So, I would say that is not an easy question to answer for obvious reasons. I think even as the Ministry of Health looks at certain things, and the Prime Minister, that is why technical advisory committees are there to advise on certain things. We certainly would have been looking at what's happening in other countries, and we would have seen from other countries that those countries that were able to have strict lockdowns and use those measures that we talked about, like staying at home, practicing the social distancing, hand washing, proper hand hygiene, washing your hands for at least 20 seconds. Those things would help us combat what is happening. So to say a true time limit, we really couldn't say, but certainly we want to make sure that persons stay at home and only come out if they absolutely need to.
We cannot.
No, we have sufficient cases now.
Very
to say
quickly,
that.
we've got to wrap up on this. Mental health.
Yes.
We have not delved into that. We don't have a lot of time, but there are people out there who are battling with mental health issues. What's your advice?
So, persons with mental health, there is a mental health hotline that's available. We want you to reach your physicians. We want you to try to stay as calm as you can. If you are on medication, please take your medications. Absolutely important. Reach out for help. We know that these are trying times. Persons may go into depression. Please call us as your physician so that we can guide you. Reach out for the help.
Dr. Pinder-Butler, thank you so much. This has been very, very important information. Thank you for the great work that you continue to do. As I told my previous guest, you really, you all really are our first line of defense, and I know it's not easy.
No, but we thank you for having us. We appreciate being here. We want our Bahamian public to be as safe as they can. Please stay at home so that we can help.
Most definitely. Thank you again for coming. Well, that's going to do it for tonight's episode. Special thanks to my special guests, Dr.Sabriquet Pinder-Butler and Dr.Darbrielle Hunt-Burrows. Also, thank you as well to my production and technical teams. Of course, to you, our viewers at home, a very special thank you for always staying with us. Do remember to wash your hands, sanitize, practice good social distancing at all times, and stay indoors, stay in your homes unless absolutely necessary. Stay tuned, of course, to this network and to our News Bahamas Facebook page for the very latest news and information on this global pandemic. Be sure to catch us next time, same place, same time, right here on The Record. Good night.